So, as a reminder, we will be releasing the slides and recordings for all of you to view and reflect on sometime later, likely towards the end of the RCG program. So, part one, health. Largely, we'll be talking about health insurance and how to take care of yourself and avail healthcare at the UW, or broadly speaking, in the United States. Now, some key terms before we get into it. These are words I'm going to be throwing out quite often, and so it'll be good that we're all on the same page. So, LifeWise is the company that's providing the International Student Health Insurance Program, which is ISHIP. Um, ISHIP is the health insurance program that you are required to be enrolled in. In fact, you're automatically enrolled in ISHIP every quarter that you are taking classes. Now, the ISHIP is specific, it's a health insurance plan specific to UW's international students. Now, this is specifically for all of you. So if you meet like perhaps domestic students, they might not exactly understand what you mean when you say that you're on ISHIP. Network and out of network. Now, this is where we start to get into some new concepts. So, what we call providers or healthcare providers, that's just what we'd refer to broadly as hospitals or clinics or doctors, wherever you might avail healthcare. So, what it means by network is that if a healthcare provider, like a doctor or a hospital, is connected and has like a deal or some sort of contract with your insurance program, we call them in network. And if they don't have such an agreement, they're out of network. So it's sort of like whether or not they're in this insurance club, if it's easier to think about it like that. And we'll talk about what type of difference that actually makes when you're trying to seek healthcare in just a moment. A copay is a certain amount that you're expected to pay with your insurance. Your insurance will cover quite a fair amount, and we'll get into all of the things that they do cover. But certain services require a little payment from your part when you first avail it. So think of it as a sort of um, an expectation on your end. Now, there aren't too many copays, so you don't have to worry too much, but we'll talk about the most prominent cases when we talk about what this insurance covers. A deductible. Now, this is exciting because I actually only learned about this quite recently, but the way a deductible works is that before insurance starts to cover your medical charges, there's a certain amount that you need to pay. That's what we call a deductible. Now, fortunately, the deductible isn't insane. It's, I believe, $100 and it refreshes on a quarterly basis. So every quarter, the minimum initial amount you need to pay is $100. That's your deductible. And lastly is the out-of-pocket maximum, which I think is the most important thing for you to know to really take charge of your own healthcare. The out-of-pocket maximum is the maximum amount that you will need to pay out of your own pocket. So if anything beyond that, insurance should be covering it. The out-of-pocket maximum for iShip is going to be $3,400 for in-network providers and $6,400 for out-of-network providers. So, worst case scenario, the most that you'll be expected to pay out of your own pocket is going to be 3,400 as long as you're working with some network providers. And shared in the chat in just a moment will be this link. It's a glossary of health coverage and medical terms. Now, I know that health insurance, from my own lived experience, is kind of can feel complicated and really daunting, but these key terms will be very helpful for you to just get your foot in the door, just get planted and find your beginning. And we'll walk you through all of the important central information that you need to know so that you can go out confidently to learn more about everything else that there is to know. So, now that we have these key terms out of the way, before you can really avail any of these services, well, you need to get set up. You need to get your iShip sorted. Now, for new international students, you are automatically enrolled in coverage when you register for your autumn quarter classes, which I believe for most of you, you have already done. And now we'll quickly go over the iShip new student checklist together. This kind of gives you an idea of what exactly happens next. So, step one, you enroll in ISHIP when you register for quarterly classes. You're already at this step. You've signed up for your classes, or maybe your A&O Part 2 is still coming up. But once you sign up, you're enrolled. And the cost of ISHIP will appear on your tuition statement and will be paid with your tuition. So fortunately, it's not too complicated when it comes to paying it. Now, the first major decision you'll need to make is whether you want quarterly coverage or annual coverage. Quarterly means that you'll be paying a set amount every quarter, and it's more helpful for students that are not staying in the US over the summer, since that way you don't have to pay for the full year and saves you some money. However, if you will be here for the full year, you should opt for annual coverage, which will cover you throughout, and you'll only pay once, I believe, at the very beginning of your annual plan. So once you're fully enrolled, you'll be receiving your LifeWise welcome email. It should arrive during the first week of coverage, and that looks like sometime after the 1st of September for most students. Once you receive this email, they will give you a link with on how to on where to go to set up your LifeWise portal account. Sorry, not a link to your insurance ID number. This insurance ID number is very important. It's a unique identifier that lets people know that yes, you have a plan. This is how they can figure out, well, all of your important details, like what your coverages are or whether or not you've met your deductible. And we'll go over a little bit more of I don't think we'll go over it, but rather we'll give you an instructions sheet later on that goes into a bit more detail on how setting up your LifeWise account looks like. And step three, which is always the best, you receive a physical LifeWise insurance card. Now, for the physical LifeWise insurance card, this will only be mailed to you in a US address. What this means is that you'll only be able to get your physical card when you arrive in the United States and you update your current address on your MyUW portal. Once you update this address, which you will need to do, and we'll talk about why, uh, you will receive this card. It'll be mailed to that address I can't give you a precise timeline, but it shouldn't take dreadfully long. And so this is a rough timeline of what your setup phase of getting ready to get started as a LifeWise insurance holder will look like. Of course, like I promised, we will share a link later on with a more comprehensive instruction sheet for your own reference. Now, the next important thing is figuring out exactly what it's like using iShip. The first difference that I'd like to clarify is in-network and out-of-network providers and what the actual differences are. Now, like I said, a doctor, a hospital, or a clinic is considered in-network if they have a partnership or a deal with iShip. And if they do, there are some benefits on your part. Largely, iShip pays more of the medical charges, like 75% usually. And you usually pay just the remaining 25% plus your $100 minimum. The LifeWise website, which we'll go through later, gives you a helpful resource to find all of the in-network providers in your area. Some common examples of in-network providers are Husky Health Center or the UW Hospital. For out-of-network providers, it's a little tricky. iShip pays 60% for most medical charges, but not all, and it will vary case to case. And so you will be left to pay the $100 deductible as well as whatever remainder that iShip does not pay for. So the other part about working with out-of-network providers is the convenience of it. With in-network providers, the billing is handled directly. So the hospital or doctor you meet will send the bill to iShip, they'll process it, and they'll tell you how much you need to pay. However, with an out-of-network provider, you will need to pay all of it upfront by yourself. And then afterwards, you're going to have to file a claim. Now, this is a lengthy process, but once you file that claim, iShip will review it and determine how much of it they will cover, and it'll likely look like a refund of sorts. You can think of it in that way. Now, what does iShip cover? Now that you know the difference between in-network and out-of-network providers, what exactly can you use iShip for? Now, this slide will have a very broad overview, and you can take your time to take a screenshot or read through it. But in general, here are some things that iShip covers. iShip generally covers basic primary care, which means going to see the doctor, either the Husky Health Center or other in-network clinics. It's just going for a checkup to understand what's going on. They also cover preventive care or preventative services, which essentially means any checkups, exams, vaccinations, most commonly the flu shots, but also your
No
meningitis or
break.
COVID
Take a deep
vaccines.
breath and stretch.
Ad Additionally, they also cover quite a bit of dental care. Dental cleanings, that falls under preventative measures. They also take care of repairing your teeth. A common example I can give you is getting a dental crown. That's something I did very recently, and iShip covered all of them, so highly recommended. And wisdom teeth removal. And of course, there is a limit. The information we'll give you right now is from iShip themselves, which is a $1,500 per plan year after you pay your annual deductible. Additionally, iShip over also helps you with routine eye exams. Up to $150 will be covered. And they'll also help with vision hardware. So that's getting new frames or contact lenses. They also provide a very wide range of mental health services, and you can avail quite a few of them from using the in-network provider search bar that they have on their own website. And of course, iShip covers, very important to know for anyone really, they cover emergency room visits. Now, this is where the copayment I mentioned comes back. There is $100 copayment on the emergency room visit. This means that when you visit the emergency room, you will need to pay $100 upfront. That's just on you. Then there's the deductible, which is, if you remember, the minimum amount that you need to pay before coverage begins, and that is $100 per quarter. After that, any other charges, iShip will cover at 75% of how much needs to be paid. Now, an important distinction to be made is that emergency rooms are for life or death situations only. There are urgent situations that need immediate attention, and then there are urgent situations that are life or death and need immediate attention. We'll talk about what to deal with the first situation where it's not life or death shortly. Now, what we gave right now is a brief overview from the ISHIP brochure discussing broadly the primary points that you should know, the main types of care that ISHIP covers. However, if you are interested in learning them in greater detail, we'll share in the chat right now the insurance benefits brochure. This is very lengthy, but it covers in precise detail exactly what you can anticipate this plan to cover. The summary of benefits is not as lengthy, but it can take a moment to try to fully wrap your head around everything that they're covering. So we recommend that you take time later on just to sit down with it. You don't need to read everything, but it's helpful that you at least get a grasp on what is covered. Next, we're going to be talking about the actual iShip LifeWise website. This is what we will use in order to find in-network providers, so that's hospitals or dentists or doctors. It's where you can use to check the estimated cost of different services. It's also what you will use to pay for any in-network medical bills. And this is all just a bunch of words up in the air. So we'll actually sit down and look at what the service looks like. So if you go into the LifeWise website, you'll be looking at something like this. Now, the iShip page here, they give you a brief highlights. They just talk about some quick highlights. It's great. I would still highly recommend that you look at the actual insurance benefits brochure or the summary of benefits. I think that it's certainly more helpful rather than getting just a brief gloss over all of the main points. And of course, you can find some key financial information, such as your deductibles, as well as your out-of-pocket maximums. Now, when you are getting set up for the first time, you will be navigating to create account, but for the sake of this demo, we'll skip ahead to the sign in, which I have already done. Okay, let's see. We'll skip ahead to sign in. No passkey. And here we are. This will land you right into your account. Now, right away, you can already see what we call claims. So claims are where providers essentially send the exact amount that needs to be paid to ISHIP. And this is where ISHIP processes it and figures out how much you need to pay. So I'll give you an example and we'll take a look here. We'll load the claim detail. And it's really important you stay on top of this. You don't want to miss any important payments. So we'll load the claim detail. Let's see. Oh, there we are. All right, so let's see. Description of service, very important. This is the service I got, the dental crown. Dates of service, and this is the amount they billed, a whole $750. Now we look at copay, $0. That means at the moment I did not have to pay them anything. Deductible, zero. That means I must have already met the requirements, so there's no minimum I need to pay out. Co-insurance, zero. And so the amount that my health plan, which is iShip, has paid, the whole amount. And so very quickly you see at the right-hand side, I owe nothing. That means I don't have to pay anything. iShip has completely covered the service and I'm good to go. Of course, it's not always this wonderful, it's not always this lovely, but this is a demonstration of what it's like to use the claim management portal and using your LifeWise account to figure out how much you owe and any active claims that are ongoing. Next, we're going to go over to before we move on to finding your network providers. Sometimes you might misplace your LifeWise insurance card. Sometimes you might just straight up lose it. If that is the case, you can always go into print an order ID card here. And so I'd recommend that you click both of these options. Why? Order ID card is straightforward. You fill in some details and they'll ship you a new physical card. Temporary proof of coverage is essentially going to be a sort of sheet of paper that says, yes, I am covered by iShip. Here's my information. You don't need it. What you really need is your insurance ID number, but it never ever hurts to have added documentation. So this temporary proof of coverage, I highly recommend if you ever misplace your actual insurance card. Now, on to finding a doctor. Let's see. Okay, we will look for a medical provider, and this will take us to a completely different portal. And there are a few elements I really like about this, which is firstly, my plan coverage. On this menu, I really like this part, which is they tell you how far along you are in your out-of-pocket maximum. And you can see so far I've paid $92 out of my 3,400 maximum. So well, I'm not quite there yet, but I can keep a nice tracker as I look for healthcare providers, whether or not I'm close to that out-of-pocket maximum. So let's say I'm not really looking for anything particular in this example. I have my address here, so it's going to look for places relative to how far they are from me. And I just want some primary care. I just need some general checkups just to see if I'm doing all right. And so, great. Let's see here. We have a list view, which is nice. You can see some names, see where they are, how far they are from me, 0.3 miles. I can see their phone number. There's some specialties, areas of focus. Two networks accepted. Okay. Well, another way that's a little easier, in my opinion, to navigate is to look at a map view. This sort of just kind of plots everyone around. Okay, I'm here. Oh, there's three people in this little network here. All right, so there's Brianna, E. Grinnell, DO, Swedish Sandpoint Primary Care. And so I can see, okay, offers virtual visits, in-network primary care provider, accepting new patients. So essentially, what this portal helps you do is that anyone that you see in this list is in network. They should be in network. And if you remember, I guess I'll just put this question in the chat. Does anyone remember how much, what percentage of the charge in-network providers cover? 75%. Thank you for being diligent as ever, Thomas. Yes, 75%. Of course, assuming that you haven't met your out-of-pocket maximum yet. So I strongly recommend using this if you're considering looking for a specialist. A lot of primary care you can already get taken care of at the Husky Health Center. But if you're looking for someone that does a very specific discipline of medicine, I'd recommend using this to look for them. So let's pull back and we'll share in the chat right now um, the instruction sheet. We're not really going to go over it too much in this presentation, but this is what it looks like. It's a very broad sort of flowchart going from left to right, just sort of discussing the steps needed. And so please take your time just looking through this, not only right now, but also after you receive the initial email from LifeWise. So this one, I know it's a lot of information, and you're learning so much about not only your health insurance plan, but also a completely foreign medical system. But hopefully, this is a great start for you to understand where to go to figure out what's covered. And at least you have ready, handy in your mental tool belt, a general list of all the things that are covered by your health insurance plan. Now, before we get too caught up in things, I think it's also helpful to start thinking about a little bit more practical information. Yes, we've given you a long list of all sorts of technical information, but let's think practically. Namely to say, okay, I'm sick. What do I do? What should I be doing? Well, there are three types of sick which we can broadly categorize: emergencies, urgent situations, and non-urgent sicknesses. So, emergencies. If it is a life-threatening situation where it is a matter of either living or dying, call 911, get an ambulance, get to the emergency room. If you are able to, or if you're with someone who can take you directly to the emergency room, great. Go right away. And we have a little visual up here that shows an example, shows a few examples of emergency situations: major allergic reactions, difficulty breathing, just and this is not an exhaustive list, I will tell you. There's plenty more. However, if you are in a situation that is urgent, so something that needs immediate care, like a gut that needs stitches or pink eye, but not quite life-threatening. You're not stuck in a really awkward middle ground between emergency room and primary care. You can go to urgent care centers. Urgent care is essentially exactly as the name says. It is a sort of middle ground where it's not life-threatening, but it certainly needs immediate attention. So some of the best examples of resources are the Husky Health Center same-day care. They sort of make sure that you will get attention immediately, or at the very least within the same day. Their number is on the screen right now, and as an added bonus, they are generally cheaper because they are in network always. And if I understand from the LifeWise insurance page correctly, sorry, this wasn't on this one. I think it was somewhere else. But I believe the deductible isn't quite as high within the Husky Health Center services. And yes, shared with in the chat right now, thank you, Marion, is the link to the Husky Health Center primary same-day care. Helpful for you to take a look at just to familiarize yourself with what to expect. Another example is also the UW Medicine primary and urgent care at Ravenna, but just good to have these things in mind. I'd say Husky Health Center is definitely a better top priority. It's on campus and much easier to access. All right. And of course, we'll be sharing a link, but emergency or urgent help is not always just strictly medical. There's a nice website by the UW Counseling Center that highlights some other situations that are also categorized as urgent or emergency situations where urgent help is necessary. And it'll be shared in the chat shortly. Thank you. So that covers, okay, super severe life-threatening emergencies and urgent situations that are not immediately life-threatening. What if it's not urgent and not life-threatening? Well, we have some resources. I think highly recommended is the 24-hour nurse advice line. It's not always feasible to tell people to just go to the hospital or go to the clinic. You know, can't really tell you where you're going to be at the time of having such a situation. But the 24-hour nurse advice line, provided by LifeWise, is really helpful. They're always on, and they can basically how it works is that a nurse will pick up your call and you'll explain what you're experiencing, your symptoms, what's bothering you, and they can give you a list of next steps or recommendations. And it's highly recommended that you listen carefully and follow them. Another way of dealing with non-serious situations is that you can consider getting some what we call OTC or over-the-counter. Over-the-counter drugs. It's called that because, well, you don't really have to go through a whole prescription and checking in with the pharmacist. You just grab them over the counter. So examples are, painkillers, most acetaminophenes, and I think most antacids are over the counter. And you can get them at most pharmacies in general stores like CVS, Safeway. QFC is very close as well, Walgreens, and in limited capacity, the district markets on campus also have a pharmacy section where they will sell basic over-the-counter drugs like painkillers. Next, since we already have the LifeWise 24-hour nurse line up here, check out this wonderful brief contact list. I recommend you take a picture or take a screenshot. This gives you a brief overview of all the most important phone numbers to keep in mind. So emergencies, always 911. You can also set up an appointment at the primary and same day care Husky Health Center at 206-685-1011. And thank you, May, for sharing the Circle Health Insurance page. This page is going to be pretty much compiling everything, or at least most of what we've talked about here. And it'll also give you an even more comprehensive list of contacts. It's basically what you see here, but an additional paragraph describing when you would use each contact. And I recommend taking some time to familiarize yourself with them. You don't need to remember every single word, but as long as you have a sense of which direction you should head. So now I know that there are a lot of, we can say, myths about US healthcare. I've had plenty of them coming into the UW, and certainly sitting through a lot of ISHIP sessions didn't really help me feel better about those myths because there's just so much information about ISHIP and healthcare in the US. So here's three important takeaways that we will hope that you'll get from this session. Well, for starters, you are entitled to care. What we mean by that is that it's not that the system's turned against you. It's not that everything's made super complicated so you never get to take care of yourself. The UW and the ISHIP actually make it easier to get healthcare than you might think. And if you're not really sure about where to go, just start by talking to a nurse, and they can help you figure out your next steps. And the next myth that I know I had was that well, okay, I'm going to lose all of my money. I'm going to spend everything that I have on healthcare. But we've discussed out-of-pocket maximums. There are limitations set in place to make sure that you cannot lose everything that you have getting healthcare here. So please seek healthcare. Take care of yourselves. It's very important. Health is number one priority. This is what my family always says. And of course, getting sick, I know that a lot of people get hesitant because it's difficult with academic performances. Actually, all through first year, I was so stubborn about it because of all of these myths and misconceptions I had. I was actually sick for every exam I took in first year. Um, so what do? You don't stay quiet and keep it to yourself. You let someone know. Let your professor know. Let your advisor know. Because if they don't know that you're going through these situations, they can't really help you. And so documenting your illness, just keeping track of what's happening, keeping track of prescriptions or any meetings that you have with doctors, as well as speaking to your professors or your advisors about these situations you're facing can help you a lot. And now you will hear more about this in course session 3 with your PCLs, but your professors aren't your enemies. They're not trying to stop you from succeeding. They're here to support you. And if your illness is getting in the way of your academics, they will help you figure out other ways to bounce back. And so remember these three things and try not to get too weighed down by all of these myths and these dreadful feelings. And of course, take care of yourself. That's always number one. And on the topic of taking care of yourselves, I would like to thank you for listening to me. And I'll hand over to Marion, who is going to be talking to all of you about safety.
Thank you very much, Sange. That is a lot of dense information. Insurance is complicated, healthcare is complicated in the United States, but like those key takeaways said, it's not as complicated as it seems on the surface. And the good thing about being both in Washington State and at the University of Washington is that it is set up to make sure that you have access to the care that you need. So take a minute to just decompress from that for a second, and make sure that your questions are getting answered. So we're working through them. So if you asked questions further up in the chat, just have some patience while we get in there and make sure that things are getting answered. You guys have a lot of really good questions here about health insurance. Okay, so safety. Safety is something that the university takes very seriously. You have a right to live, work, study, and socialize in a place that is free of violence and harassment, and to feel safe where you live. And there are a lot of resources on campus that are here to support you in that way, and not just in your physical safety, but also your emotional and mental well-being, and in your relationships with others. So we're going to walk through a few of these. I love all the reactions that are being used today. It makes me feel really good that you guys are paying attention. Or at least a couple of you. So, the first resource that we have here is called UW Alert. And once you're here on campus, you're going to start getting used to seeing these alerts pop up. This is a automated system that notifies students via text and email of any emergency situations or things that are going on around campus that everybody needs to be aware of, right? So sometimes it's something as small as there was a hazardous material spill in one of the labs, right? So don't go into that building for right now where they've closed it off and they're working on cleaning it up. Or it could be there's downed trees because of a storm, or as we see here, smell of natural gas at one of the buildings, or the Canvas platform was down for a whole day. And so UW Alert will notify you updates as these things are happening and going on. So for example, if you go back for a second, Sange, when you see these alerts come through, they're going to look something like this, and then you can click in to read more. So for example, the hazardous materials response at Denny Hall, right? You click in and here you see all these updates that they have, okay? The fire department was dispatched. They have evacuated the room. Nobody's been injured. They're advising you to avoid the area. Okay, and then the last update says that it was just a desiccant agent used in packaging. It's not harmful. The building is reopened, right? So this is an easy way for the university to reach everybody and let them know what's going on. Sometimes you'll see things on here that might feel a little bit scary because we do live in a big city. So sometimes there are reports of robberies and things like that as well. But this is just a way to keep you informed, and make sure that you're aware of what's going on in the community around you. And you'll be automatically enrolled in UW Alert. When you, when does it happen? Actually, I'm going to ask Sange that question.
Oh, the auto enrollment, I believe. Oh, yes, Thomas.
I think that we needed to enroll in it when we did like the Husky checklist before even part
Great.
one. I think that
Great.
met the requirements.
Thank you very much,
Wonderful. Thank
Thomas.
you so much. That's perfect. See, that's something I don't go through, so it's helpful to have you guys on hand to let me know about that. So
Thank you,
yes,
Thomas.
you will be automatically enrolled in that. So once you get here, you'll start to receive those alerts. Okay, next. Okay. Another really great resource, two really great resources on campus are Husky Safe Trip and the Night Ride Shuttle. And these are in place to help you get around campus safely at night, to get home safely. We are a big campus in a city. UW is an urban campus. Although we have our own little kind of enclave in Seattle, we are in the middle of the city, right? And so it's not always a good idea to be walking across campus in the middle of the night by yourself when you're up late studying, or maybe you went to an event. These are two options that will help you get where you need to go safely. The night ride shuttle, let's click into that. The Night Ride Shuttle is an actual shuttle bus that has stops around campus, and runs in the middle of the night and will take you from various locations, to different drop-off zones, right? So if you are on East Campus and you need to go all the way up to North Campus or something like that, you can find where the shuttle stops are, use your Husky card, it's free. This is a really helpful way. Yeah, you can check out the zone map here. You can see where the stops are. So this is a great way if you know that you need to cross campus in the middle of the night, you're going to leave the library, you don't want to walk through campus, maybe you don't have any friends with you, so you're going to be by yourself. You can take the night ride shuttle. Okay. Now let's go back. Poke around on that website yourselves when you have time. And Husky Safe Trip. This is a 6:30 p.m. to 2 a.m., so really the middle of the night. Safe Trip is a ride. You're getting a ride from a University of Washington campus police officer. This is not the Seattle Police Department. This is our own University of Washington safety officers. And you give them a call, they will come and get you home. It's a really great option, especially if you're somewhere that you're feeling a little unsafe. You can give them a call and they will get you to your dorm or your house, and they will escort you there. Yeah, this is a really, really amazing service that the University of Washington offers. Have your Husky card. As always, keep your Husky card on you. And check through the website to make sure you understand what the zone is of where they'll go. But the UW campus safety officers are really great, and they're here specifically for you students. So if you are looking for a way to get across campus safely at night, check these two things out. Okay. In the event of an emergency, you have a couple of options on campus, right? Always call 911. You can call 911 even if you're not sure if it's a real emergency, because they will direct you to the right place if it isn't, right? That's what the dispatchers do. They can determine if something needs emergency attention or not. If you are on campus and you can't call 911, or you don't have your phone, you can use one of these emergency phones that are stationed around campus. You will recognize them by the the blue, or it looks gray on this, but it's kind of a brownish pole. But all of them have a blue light on top, right? So in the middle of the night or in the dark, it gets dark pretty early here in the winter. You'll see these blue light posts. Those are emergency phones, and they connect you directly to campus safety and will make sure that you can talk to 911 and speak to an emergency dispatcher.
If I may add
Yeah.
just quickly, so that you can learn where these things exist in the map, all you'll really need to do is you'll just type the UW campus map. And this is very exciting because they've recently updated it. Um, Go here, just clear everything, and select emergency phones. And with that, you get a nice quick overview of where these emergency phones are on campus. It's the big blue light's helpful, and it's also additionally helpful just to see where they are. All right, sorry for that interruption, and I'll hand it back.
No, that's super helpful. It's also nice to know that when you're on campus and you dial 911, you will be connected to UW police. If you are outside of the campus zone and you dial 911, you'll be connected to the Seattle Police Department. So depending on where you are, it's going to be a different response, but you will be connected to an emergency dispatcher. And again, they can help you determine what emergency response needs. You are not required to know what you need in that situation. Okay? In a non-emergency situation, there are also other options for you. Safe Campus is an on-campus department that is here to provide guidance and support and even safety plans for you if you find yourself dealing with situations like um, inappropriate behavior from professors, classmates, friends, really anybody, any kind of verbal or online threat. If you witness any sort of neglect or abuse, sexual assault, harassment, stalking, relationship violence, these things are all addressed by Safe Campus. You can contact them anonymously. And they are really good at what they do. They're available to help you and to help you if you are witnessing it happen to other people. It doesn't have to be something that affects you. If you are at a party and you hear from a friend that something happened to them, or you are, witnessing something going on in a class that makes you uncomfortable, in terms of a student being, threatened or anything like that, you can talk to Safe Campus about the situation and they can guide you through how to respond or how to help that person seek their own help. They have an email address and they have a phone number. And again, you can talk to them anonymously. That means they don't have to know who you are, but they will give you help. So there is this new app called Safe Zone, and this is a really great tool for especially your international students to use to get access really quickly to safety assistance. So you can download this app and you can have really quick access to non-emergency contacts to call for urgent medical help and to call for an emergency. So again, if you are on campus, it will direct you to the UW Police Department. If you're off campus, it will direct you to the Seattle Police Department or whatever 911 jurisdiction there is. It can also help you share your location with the UW Police Department if you are walking home late at night by yourself and you're a little bit nervous and you want to make sure that somebody knows that you're walking home by yourself and that knows that you get home, right? So you can say, you can set a timer and you can have a check-in so that if you don't hit that check-in button, the UW Police Department, after a certain, amount of time, if you don't check in, they're going to come and check in on you, right? So it's a really nice way to sort of just have a backup safety plan and to feel like you have something in your hand that you can access all of these features right at once. This is a new tool, so definitely look at the link that Mei Chen put in the chat and download this when you get here. It's a great first thing to do when you get your phone and make use of that if you need it. So these are some really important safety contacts. This is a great screenshot opportunity. But we will also, this will be provided to you when you get here. We actually have a magnet that has all of these things for you when you get to campus. And this will also be shared in a lot of different places, but it's nice to have just a screenshot on your phone so that if you need it, you can grab these numbers. You have a lot of different options here. Again, we've gone over emergencies, University of Washington Police Department, safe campus, night ride, safe trip. Also on here is the Housing and Food Services RA, your residential advisor. There's an on-call RA at all times of the night. So if you are in your dorm and something's going on, something doesn't feel right, maybe there's somebody there that shouldn't be there, you can always reach an RA on call. And you can call that number, and there will be somebody there who is ready to talk to you and to help you figure out what to do in a situation. We also have an email address here to report any scams. This is a really common problem, way more common than you think, especially for international students. There are a lot of really sophisticated scammers out there who are going to try to prey on your status as an international student to try and get you to give away information and pay money. If you suspect that something doesn't feel right, that doesn't sound right, if you suspect that a friend is maybe talking to a scammer, you can report it at help@uw.edu. You can also reach right out to Circle, forward us any emails, let us know. We will tell you if it's a scam. The other thing you can always do, go into Google and just type, I don't know, maybe they're getting a employment offer that sounds a little too good to be true. It doesn't sound right. Type that in with scam and then see what pops up. You might be surprised that some of these things are more common than you think. But you can always make a scam report there. And then we have a web page here that just outlines a little bit more about all the different rights that you have, not only as a University of Washington student, but also as an international student. I think this is just helpful for you to read through when you have some time so that you can feel a little bit more confident about the things that you're entitled to and how to ask for help knowing your rights. It's important that you know your rights so that you can stand up for them in a situation where you might need to. Okay, we're going to run through a couple of different common scenarios that you might run into. And I'm going to see if maybe anybody has any ideas. You can put them in the chat of how to address the situation when they come up, okay? So let's start with the first one. Your roommate is having some marijuana in your dorm. What do you do? If anybody has any thoughts on this, you can type it in the chat. What is marijuana? It's also known as weed or pot. It's commonly smoked in the United States. But the dorm owner, no. Yes. So if you encounter marijuana in your dorm, there's a couple of things you should do. First, ask your roommate to stop or go outside, right? This is it is not allowed to use marijuana in the dorms. It's not allowed to smoke in the dorms, anything. But there are different forms of marijuana. It might be smoked, it might be eaten, it might be vaped, but it is not legal to have it in the dorms. So ask them to go outside, or if you don't feel comfortable doing that, you can report to your RA or the apartment office if it's not on campus. Keep in mind, in Washington state, it is legal for US citizens who are older than 21 to use marijuana. US citizens who are over 21. The complicated thing in the United States is some states have legalized marijuana use and some states have not, but the federal government has not legalized recreational marijuana use. You, as international students, are required to adhere to federal law. Your visa is from the federal government. You, even if you are 21 years old, are not allowed legally to use marijuana here in the United States. So you will want to, again, confront your roommate, whatever your relationship is with them, if that feels comfortable, and say, please don't use this in our dorm, or please don't use this in our apartment. If you don't feel comfortable doing that, reach out to your RA, reach out to your leasing representative, and then I would say, remove yourself from the situation if you can. But I also want to let you know that this is not an uncommon thing to encounter on a college campus, and not uncommon to run into in Seattle. Again, it's legal in Washington State. So you might be surprised because this might not be common where you're coming from. But don't worry about it too much unless it's happening in your dorm. And just don't partake. Okay, next scenario. A non-resident, so someone who doesn't live in your building, broke into your dorm or apartment. What do you do? Call 911? Yes, you call 911. Or you call the RA if you're in your dorm room, or you do both. Avoid them. Don't engage with them. I can't emphasize to you guys enough. Don't let people into your building that you don't know. That applies to the dorms. It also applies to apartment buildings if you're not staying on campus, right? This is something that people do to be nice, right? You see somebody behind you, you hold the door open. But that's not the way it should work. You guys have cards to access, you have keys to access. If you don't know the person and you know they don't live in the building, that's okay. Let the door close, let them wait for whoever it is they're coming to see. That person can let them in. But if somebody's in there that you don't recognize as a resident of your dorm and your building, call your RA and call 911. Okay, next. It's late at night. How do you get home from campus? This one's easy because we've already talked about it. Yes. Safe trip, night ride, excellent. Or go with a group of friends. Yeah, night ride, safe drive. You guys are great. You've been paying attention. I love it. You can also go with a group of friends, right? It's always a great idea to travel in a group, just for safety, but also for fun. And you can use those resources that we shared as an individual or as a group. We have a raised hand. Did you want to ask a question? Or was it an accident? Okay, I think it was an accident. That happens. You can also, if you're late at night and you're thinking about how to get home from campus and an emergency comes up, you look for those emergency phones. You call UW-PD or 911, or you use that Safe Zone app. Okay? All right, final thing. Final scenario. There is an unhoused person camping outside your building or dorm. Okay. This is less of a what should you do and more of a how should you, interact or not interact. Mostly I want to let you guys know, again, because you're coming from places where you might not encounter this that often. Unfortunately, in Seattle and a lot of other major cities in the United States, you are going to encounter homelessness, visible homelessness. You will see people on the street. It's probably going to make you feel uncomfortable. What I really want to stress, uncomfortable is not the same as unsafe. Okay? This is a common misconception. And the majority of people who are unhoused, who you might see on the street, are not dangerous and they simply want to be left alone. They might be smoking or even you might see drug use, but that doesn't mean that they're a danger or a threat to you. Treat them as you would any other stranger. If they say hi to you, you can politely say hi and move along. You don't have to acknowledge them, but just don't treat them as if they are a threat from the very beginning, right? It's just something that you're going to encounter here in Washington, and in Seattle. Unfortunately, it's a problem that we have in a lot of our major cities right now. So we just want you to be aware of this so that you're not startled. It'll be more common in places like the train station, in places like downtown Seattle, where there are a lot of services in the same area. And there are parts of the university district where you might see more of this. So that is my advice to you about that. Okay. All right. Final tips. For your health, stay stocked up on some common medications. If you're able to bring them from home and they're not prohibited things to bring into the country, bring them with you so that you have things that make you feel good and comfortable when you're here, right? Keep yourself stocked on common things like painkillers, antacid, throat relief. I don't remember what ORS stands for, Sange, but thank you. Oral rehydration solution. Things that make you feel comfortable when you have a cold, when you're not feeling so well, right? That way, when you do get a little sick, you don't have to go out and purchase them for yourself. You have them right at home. We suggest you keep a mask handy. This is a big university with a lot of people. Folks around you are going to get sick, so it's a great idea to mask up when you get sick so you protect other people, or when you know someone around you is sick, or you know you're going to be in a big crowd where people might be sick, especially at the start of the school year. Oh my gosh, everybody gets sick right at the start of the school year where you're all coming in from all different countries and getting off of planes. It's a good thing to have masks on hand. Get your flu shots. You can do this at the University of Washington. We have flu clinics. We actually are going to host one at Circle in our office. You can come and get your flu shots for free with ISHIP. And that will help you a lot. It will protect you from getting bad flu. When the weather gets colder, be a little bit more careful, right? Your allergy season might be longer here than you're used to, or you might develop new allergies living in a new place. This does happen, and it might surprise you. Seattle is pretty mild, so you might encounter more allergy. I love all these reactions. You might encounter more allergens than you're used to, and that might help you feeling kind of icky. Drink more hot beverages, bundle up when you go outside, just take care of yourself. And remember that your mental health is really important too. And I add this at the end when we talk about the weather changing, because one of the things that Seattle is known for is something that we kind of half jokingly refer to as the long dark. And that is the period from October to about March where we have very short days and it gets pretty gloomy. We don't have a lot of sunlight. And it's kind of damp and rainy. And that can really do a number on people's mental health if they're not used to it. And even if they are used to it. So you want to make sure that you're paying attention to how you're feeling physically, also emotionally and mentally. Make sure that you're doing physical activity, that you're eating well, that you're doing things that you like and not just focusing on your academics, but you're also making friends and finding time to do things that bring you fun and relaxation. Okay. Final tips for safety. The most important thing I can tell you is to use your common sense, okay? Be aware of your surroundings. Pay attention to what's going on around you and who is around you, where you are. Don't walk around by yourself with your headphones in late at night or when it's dark in your poorly lit places. Make sure that you go with a buddy. Have somebody who checks in on you. Say, I'm heading home. I'll text you when I get there. Make sure that you're familiar with the common places that you're traveling to, so that you know what to expect and what to look out for. A great tip is to save 911 in your phone as a person so that if you're in a situation where you want to dial 911, but you don't want someone to know that you're dialing 911, you can act like you're calling a person. Also, learn on your phone what the emergency button is, right? So on my phone, for example, that's my old dog. If I hold these two buttons, the emergency options pop up and I can swipe to get 911 right away. All phones have a model like this, so just figure out what works for your phone. And you can invest in some self-defense materials like pepper spray, a flashlight, a whistle, and be ready to run after you use those. It's always whatever you need to do to protect yourself in a situation. If you find yourself in a dangerous situation, we want you to do it.
Thank you very much, Marion. Um, it's a lot of information that we've covered today. So we've learned so much. There's so many resources, and we genuinely really hope that you take away a lot. But I guess today's main takeaways in summary are, firstly, there are, as you've just seen, so many resources and services available to supporting UW students. And that's like Marion said, it's not to scare you. We want to make sure that you're prepared and ready and empowered with everything that you need to know, all the tools we have for you. That is a very cool Pokemon. Yes, thank you. Um, And more importantly, be proactive. You need to take advantage of these resources. You need to make use of them. Your health insurance, all these safety resources. These offices and resources can't help you if you don't use them. And lastly, you are not alone. The university is here to support you, and as are your loved ones and all of us here at Circle. And this expands beyond just us. There are professors, many people who work at these offices, all of these programs like Night Ride and Safe Campus. There are people behind them, and all of them are here to support you. So we hope that despite all of this information that we've dumped on you, these are the main takeaways you take. And of course, as we close off this session, just letting you know the upcoming sessions we have in the RCG program are core session number 3, where we'll talk even more about campus resources to support you and about how to reach out to these resources with your PCLs happening sometime this week. We have an off-campus housing info session happening. Actually, it's like 23 hours, no, 22 hours from now. That's my cheat code for avoiding time differences. 22 hours from now, there is an off-campus housing info session. For information on how to register, you can check for an email from your PCLs. They should have the registration link there. This weekend, we have weekend activity number 3. This is going to be a trivia with other international students, and like we said at the beginning, there are prizes to be won. So come by and show off that you actually know the most about international trivia. And of course, next week we have featured session number 5. Now, this session we'll be inviting international student services to talk about important immigration information and post-arrival resources. However, unlike other featured sessions, this one will only have an English session running for an hour from roughly 8 p.m. to 9 p.m. Seattle time on the 4th of August. Of course, that is all we have for today's featured session. And do we have time to open up the space for questions?
I think you can
Oh,
stay and
yes.
ask your questions in the chat
Ah,
if you have questions, and Sange and I will stick around for a little while and answer them in English. Um, can we get all the details about ISHIP sent over to us? You will have access to these slides in this recording soon. You can also you can Google the ISHIP information and find all these links, but your PCLs can also share these links with you and check out their core sessions. They'll have more information about this coming up too. One of the things I also neglected to say earlier that I just wanted to make sure to put in here when I was talking about your rights as students, one of those rights is privacy. So we've talked about FERPA before, and we'll talk about it again. You'll hear more about it. But as students at the University of Washington, your health information that is related to your academics. So if you go to a counselor at the University of Washington, for example, that is protected information. It's private information. Your parents don't get to know that information unless you choose to disclose it. So I just want everybody here to know that there is a strong emphasis on privacy in the American healthcare system, and so your medical records, your academic records, these are all protected. They belong to you, and you get to choose who has access to them. Okay. So if that's something that might deter you from going to seek counseling, from going to the doctor, please don't let it. That's all. Thank you guys so much for coming, and feel free to stay and ask some questions or to reach out to us or to your PCLs with more questions as well.